When they come back in the room and they got the screen and they got the pictures, and it was a little somber, you know. The end was in sight. You know, you got cancer. But we don't know if it's bad. They didn't know. I mean, it could have been just a benign thing. So that was on a Wednesday. Saturday was the call.
We had an elderly patient who came in for a colonoscopy, and it turned out he did have colon cancer.
When they come back in the room and they got the screen and they got the pictures, and it was a little somber, you know. And the nurse was, you could tell that there wasn't no sunshine in there, baby. So I'm sitting there reading, I counseled for years, so I'm reading body language, and I'm going, oh, okay. So he's going through each step, and he says, then number 6. He said, there it is, baby. And I go, holy mackerel. He said, well, it's not bad. But he said, we've seen them a lot worse, but we caught it early.
Discovering a colon cancer is not good news to tell anyone, and I have a tendency not to shade that news. So if I find a cancer, I tell them that day.
But we don't know if it's bad. They didn't know. I mean, it could have been just a benign thing. So that was on a Wednesday. Saturday was the call. So I'm sitting in a parking lot going in to soak at the hot springs at White Sulphur Spring. And so I start crying. Because he said, you know, it's not that bad. And it really hit me how serious it was, but his calming voice, he said, you should go see Ofer.
We were able to diagnose it and mark it for the surgeons, and we set him up with surgery within a week's period of time.
Gary came to my office from a referral from Dr. Andy Gentry. He had a mass in his colon, he had a few large stones within the gallbladder, and there was also a concerning lesion on his liver. When you have such a complex operation involving 3 different body systems or organs within the abdomen, it can sometimes be very difficult to deal with traditional laparoscopy. He was looking for a minimally invasive surgeon to be able to accomplish these 3 tasks.
I said, I'm sold. I don't have any problems with it, except one question. What's that? Do you like video games?
When I told him that I did, he felt I was the right person to go forward and do robotic surgery for him.
And we laughed and rolled over that.
The primary reason we were operating on Gary was his colon cancer. So we started with that portion of the case and able to essentially remove the portion of his colon as well as the lymph nodes around the cancer. With a big operation like that, if we had to make a large incision or do it in a traditional open approach, I would have expected Gary to be in the hospital for 7 to 10 days. Gary went home within 48 hours after his operation.
So that part, for this community, puts us way above. If something goes wrong, it's right here. They don't have to go somewhere else to get it. It's here. And that's because this hospital, Bozeman Health, has hired and put the financial commitment behind the community to say, we're going to provide the best we can get.
Currently, we can say that Gary is cancer-free, and that's always great to say. Not all patients we can ultimately say that to, but everybody along the step of the way, Health Connections, Dr. Gentry, myself, medical oncologist that's taking care of him now, have all taken part in Gary's care. And all of that's available here in Bozeman.
You've got a young staff, they care, they're empathetic, they have good bedside manner, and what more could you want?